मेरा नाम सुरेंद्र कुमार है। मेरे को जुकाम से लेके बहुत प्रॉब्लम थी। मेरे को सांस भी नहीं आती थी, रात को सो भी नहीं पाता था, और स्मेल तो मेरे पे कम से कम 30 साल से नहीं आ रही थी मेरी। डॉक्टर संजीव चावला का नाम नेट से सर्च किया, और जब क्योंकि हमारे नाक में बहुत पॉलिप्स थे और साइनस भी बहुत तगड़ा था, लेकिन डायग्नोज करने के बाद में डॉक्टर साहब को दिखाया और उन्होंने जो सजेस्ट किया उसके हिसाब से हमने ट्रीटमेंट शुरू कराया, ऑफिस सर्जरी कराई, और उसके बाद से हमको 100% रिलीफ मिला इसमें, और पूरा आराम है। किसी तरीके की कोई दिक्कत नहीं है, और स्मेल भी पूरी 100% स्मेल आ गई मेरी 30 साल के बाद में, और बहुत अच्छा महसूस कर रहा हूँ मैं। और मैं चाहूँगा कि और भी कोई इसको देखे तो ज़रूर एक बार कंसल्ट जरूर करें डॉक्टर साहब से। थैंक्स डॉक्टर संजीव चावला और कैलाश हॉस्पिटल, जहाँ से हमको इतनी अच्छी सुविधा प्राप्त हुई इसकी।
Sinonasal polyposis itself means there is very extensive involvement of facial paranasal sinuses and bilateral nostrils by the extensive polyps. Now, this disease, it affects the patient's life to such an extent that the patient won't be able to breathe through his nostrils because his nostrils are blocked. He won't be able to sleep comfortably because his nostrils are blocked. And third and the most important symptom that most of the patients complain is that they are not able to smell. So either the smell is gone totally or it is gone partially. So when they can't smell, even the taste sensation gets affected, it gets altered in most of the patients. So this is how it affects the quality of their life. So what is needed in such patients is a very holistic treatment approach. So this approach basically includes the surgical part if needed, that is needed in most of the cases because you have to remove the polyps. So what are polyps? These are basically allergen loads that we are supposed to reduce through the surgery. So that is the basic purpose of surgery. But surgery alone won't suffice in such patients. So additionally, what we need to do is to know exact the phenotyping of the disease, what kind of disease the patient is carrying, that there are various parameters that we follow for that. And third thing is about the treatment of allergy. Since allergy is involved in most of the cases, not in all the cases, but in most of the cases. So this has to be treated separately. And the fourth most important parameter is about the supervision, about the monitoring of such patients that we need for a long term. The duration of this monitoring is decided by knowing the exact phenotype of the disease. So once we know the phenotype of the disease, then we know exactly how long the patient needs to be monitored. So if these things are followed properly by us and by the patient as such, then the disease can be controlled to a certain extent or to a majority of the extent. So that's what the procedure we are following at Kailash Hospital, Sector 27, Noida. I'm Dr. Sanjeev Chawla, ENT Surgeon. If you have any queries, you can contact us.